I'd like to turn the microphone over to Dr. Liam McGowan, who, as I said, is from Grand Prairie, and listen to some of his insights and perspectives on this situation.
Some of the solutions that Carrie alluded to, for example, having STARS do the transfers of sick people from the international airport to the definitive tertiary hospital. The tertiary hospitals in northern Alberta are the ALEC, University Hospital. They can provide all levels of care. Secondary hospitals are places like Grand Prairie, Fort McMurray, less so, Lethbridge, Red Deer, Medicine Hat. Okay. So the tertiary hospitals are where you're going to go if you're really busted up. Really busted up. If you're really sick, if your kidneys don't work, if you need some of these big interventions. Grand Prairie, for example, we cannot handle vascular surgery, blood vessels. If you're having an aortic aneurysm dissection or abdominal aortic aneurysm rupture, then Grand Prairie is not the place for you. You have to go to Edmonton. If you need neurosurgery because you've had a head injury, a closed head injury, or an open head injury, even worse, then you have to go to Edmonton. Likewise, if you've got some sort of cardiac event, Grand Prairie is not the ultimate place for you. You have to go to Edmonton. And the way that you are going up until the 15th of next month is through the city center airport. So closing that airport is going to have major deleterious effects for everybody in the north. Now, Keith is going to speak for a bit here, and STARS. Okay, so STARS is not going to be the answer. I really can't see it happen. I can't see the helicopter being able to provide the shuttle service from the international airport to the tertiary care hospitals, to the 2 tertiary care hospitals. And every time there's a transfer of care, it takes forever. So the nurse, the paramedics will come along with the fixed wing transport, land at the international airport, taxi their 12 minutes over to the hangar, shut down the engines, unload the patient, put them into this triage area where they'll meet the nurse paramedic team from STARS. They'll have to give a report. They'll have to say, this is what's wrong with this patient. These are the allergies. This is a past history. These are the infusions that this patient is on. One of the things that the Health Quality Council report pointed out was that there are inconsistencies in the drip sets that everybody uses across the province. And they rightfully suggested that we standardize that so that all of the transport people use the same sets. Hasn't been done. It's nowhere near being done. That is probably the simplest thing that we can accomplish, but it hasn't been accomplished. So what that means is when they transfer the care from fixed wing to rotary, everybody has to stop the infusions on one set, mix up a whole new batch on another set, and start the infusions again. It takes time. Likewise, what do you do when the helicopter isn't there? The St. Paul's crash, for example, remember when that van, I think it was a minivan, drove into the school and crushed those kids. There were 3 victims, 3 children. The helicopter was dispatched from Edmonton, STARS helicopter, and 2 fixed-wing transports were made available. 3 kids came back. What would happen if the city center airport was closed? They'd come and land at the international airport and do what? Wait for the helicopter? The helicopter is already involved. And what if the weather is bad? Or the traffic is worse, or is terrible? And remember, that's the busiest stretch of road in this province, from the airport up into town. What's going to happen? Time is going to be wasted, and somebody is going to die.